The thing with Botox, for it to be effective, and I had
Mm-hmm.
this conversation with a certified dermatologist. He told me that you will need or you require 3 milligrams of botulinum toxin.
Mm-hmm.
And if you look at the cost analysis, especially here in Kenya, that 1 milligram is like 40,000 Kenya shillings. So having three, it's 120,000. And it's
Mm.
exclusive of consultation fee and painkillers, because that thing,
Oh,
yeah,
yes, yes.
it's painful.
Yeah.
So imagine you're having to pay 120,000 for you to be dry for a whole year. Meaning I can use the same amount and get Dermadry or any other brand that I see fit or I choose, my brand of choice.
Mm.
With Botox injection, you have to do it annually.
Mm.
Even the financial burden, it's too much.
Yeah,
Spending
not just annually,
120.
right? Like it lasts, no, it doesn't last like for an entire year for everybody. Like
Mm,
that's also
mm,
experimental, right? Like it
mm.
lasts maybe for like a few months, like 3 to 4 months. Again, like these are just uh, like anecdotal things that I've read online. So if you have the money to try Botox, try this first.
The
Yeah.
reason why, uh, in terms of the effectiveness, the period of effectiveness for Botox, if I may speak about our country,
Mm-hmm.
uh, we even have dentists who have this botulinum toxin. So for most of them, it's purely business. So they'll inject you yet less units so that you can keep going back.
Mm-mm-mm.
But if you go to a certified profession, then you're guaranteed you're going to get an extended period of time. But
Mm.
the financial burden is too much. So I always tend to give the hyperhidrosis family options. Before you go straight to Botox injection, why don't we try topical treatments first? Because at the end of
Mm-hmm.
the day, you will never know they work till you try. So you
Yeah,
start
yeah.
with your topical treatments, and then now we start picking up on levels, antiphoresis machine.
Mhm.
We consult a dermatologist, we run a medical test just to ascertain whether you have primary focal or secondary generalized. There could be some underlying causes that we may not be able to detect just by looking at
Mm.
your sweat. And then now we combine with an antiphoresis machine. I'm also very keen on oral medication because, again, we have individuals who are doing self-medication. They just go and buy some of this oral medication, and they are not even aware of the side effects apart from, the dry mouth and the dizziness, drowsiness, and
Yeah,
so on
what
and
was
so
this like
forth.
glycopyrrole? I forget. Yeah, I've tried that too.
Glycopyrrolate. I did
Yeah.
myself in 2017, and man, the side effects were horrendous. I couldn't even take it for a whole month. Now I had to go back to the dermatologist, and he reviewed my prescription. So he gave me
Oh.
one where I only take it when necessary. So oral
Mm-hmm.
medication didn't work for me, no.
Yeah,
But
it didn't work for me either.
I urge the hyperhidrosis family, just don't do this self-medication. Consult a dermatologist. They need to run medical tests.
Mm-mm.
These anticholinogenics are in different groups. So you have the likes of glycopyrrolate, you have your oxybutynin, you have others.
Mm-mm-mm. Mm-mm-mm.
So they
Yeah.
have to run some medical tests just to be sure that if I start you off with this dosage, you'll be able to handle the side effects. So you're doing your own self prescription, and you're not sure of any other underlying causes, and you're still unaware of other extra side effects, because I know some of them, they also affect your bladder.
Yes, yes, exactly. I was not
You
able
guys
to like
don't
use the
know.
restroom. That's all that happened to me. I didn't control my sweat at all. It made my lips and my skin a little dry. That's it.
It's because
Yeah.
they do not target the specific area where you want the sweat to reduce. They control the whole body sweat.
Yeah, yeah.
This is why now you have to hydrate more than often. So it's always
Mm-hmm.
good, and I urge the hydrosis family. Just consult a dermatologist, let them figure out which proper dosage to start you off with.
Mm.
Meanwhile, you can try all these other treatments. You have your topical treatments, which have also been proven to work. Again, in percentages, 50% is better than zero. I think we should
Yes.
be more appreciative of the change in sweating patterns. 50% is better than zero, no?
Yeah.
And then now you have your antiophoresis machine, which is more of long term, and it's even much better for palmar and plantar hyperhidrosis. Reasons being, there are people who react, they have a severe reaction when it comes to lotions. They apply a lotion on their palms, they sweat excessively. So,
Yes, it exacerbates it. Yeah.
so the device will be much better for individuals who have that severe reaction. Uh,
Mm.
what is your experience with the device itself? You know, with the treatment. How far? You know, so far, how has the experience been for you?
Uh, with with the device that I have right now, I'm very much satisfied with it. And the big source of relief is that I've been able to use the water source at my place, and that has worked out wonderfully for me. Um, and it's really good for me to not have to switch the polarities by myself manually. I know that it's working. Uh, yeah, I mean, like its function is pretty standard, so I wouldn't say anything about it. And I like the fact that the voltage goes up higher than I think ion to derma that I had before. Yeah, so I I think I have a severe hyperhidrosis, like water drips from my hands, well, when I don't take any treatment. So I need pretty high voltage settings for the treatment to work for me. So I'm glad that that is something that I get to control by myself. Like I mentioned, I went to the clinic and they were really scared to, you know, hike the voltage. And I also want to bring up the point that, you mentioned that the doctors run tests, diagnostics, and all of that, right? I've never, the first dermatologist that I consulted in India, they never they didn't run any tests. They asked me what my experience was. I told them about it. That day I was not sweating. That was that was unfortunate. One day I wanted to sweat and I wanted to show, but I wasn't. uh, and just from hearing my experience, they diagnosed that I had primary hyperhidrosis. So the causes that you mentioned, I mean, the other possible causes that people may have for hyperhidrosis, I was not checked for that. But since I've had this from, when I was 5 years old, I'm also convinced that it's primary hyperhidrosis. So that's a good point that you bring up. Not every doctor, I think, is aware of the fact that there are tests that you can run. They just ask you, how long have you had it? Do you sweat when you're sleeping? And you say no, and they're like, yes, this is hyperhidrosis, and you can go for Botox. This is a plan that I have. Do you want to take a look at it? That's how the conversation goes. So I think some awareness on the part of those with hyperhidrosis, that it's unfortunate that we need to pick and choose the medical professionals, because these are certified professionals, right? They should be able to um, know what to do when you come with a problem. But yeah, if somebody just talks about it and straight away goes to Botox, even though they're a medical professional, I think you need to take a step back and consider if you can look at other options yourself.
You see, back in 2020, when I was connected to a certified dermatologist in our country, he's known as Dr. Hashim, and he's also online, he's on the portal. When we met, we had like a 20 to 30 minutes discussion just on hyperhidrosis. And he told me a lot of things. Number one was the lack of treatment, including even the oral prescription medication. Especially the availability of those prescriptions in the hospital's in-house pharmacy. They didn't even have topical treatments. As a matter of fact, there are some topical treatments you won't find in the nearest pharmacy or any nearest pharmacy, whether it's around the city or around the neighborhood. And this is because of lack of awareness. So the more we push on the awareness, the more now people are able to realize that I have options. I have brands that I can experience. And out of that experience, I'll be able to find a go-to brand that works for me. The only available topical treatment in some of these pharmacies will be the likes of dry cleaner. And the dry cleaner that is available, you cannot compare it with the dry cleaner that was there some time back. A lot of change, and there are also guys who are counterfeiting the original product. I mean, there's so much that is happening that is crazy, So when it comes to the testing, it's very important to test for any underlying cause. Reasons being, let's say for instance, I don't have hyperhidrosis and I feel unwell. What's the first thing they do even before you go head straight to see the doctor? They have to test for your vitals. They have to check your blood pressure. They have to check your blood sugar, those simple basic tests just to ascertain that the normal basic tests are okay. So now it's time to go and see the doctor for the next level consultation in terms of treatment. So it's the same thing with hyperhidrosis. And through the discussion, 3 years later, 2020, 2021, and 2022, we have more than 10 people who had hormonal imbalance that was affecting the excessive sweating. So hormonal imbalance is more secondary. So you have an individual who believed my sweat is PFH, but when they went to the doctor and they were able to find the medical results, they depicted that they have hormonal imbalance. When the hormonal imbalance was sorted out, the sweating decreased and eventually it went away. Others had severe side effects to certain medications that were taken. Others had undergone some form of surgery. Now the side effect is secondary sweating. So it's not always PFH. Even if you have PFH, you're not staying the same person year in, year out. You're growing.
You're correct.
So definitely your body is experiencing changes. So it's always important to go and have some of this checkup just to rule out any possibility. And it's imperative because if your excessive sweating is increasing, there is higher chances that there is something that is affecting and triggering the sweat. So it's important. I always encourage people to go for this medical test just to be sure. I'm sure you'll want to know what type and category of sweat you fall under. It's very important. And it extends to the other sweat issues as well, the likes of bromhidrosis, anhidrosis, or even fish odor syndrome. So it's important, and I'm encouraging guys to go for some of these checkups.
I think that's a very important point because there isn't awareness even among the medical professionals. And we rely on them to tell us what's going on and suggest the best course of action, right? So it's not treated holistically. You go, you tell them your problem. It's either entirely dismissed. That used to be the case before. I think now there's an improvement. People know, and when I say people, I mean doctors. Doctors know what hyperhidrosis is, and they are able to list out different treatments to it, and that's good. That's a step in the right direction. But these tests and all that you've mentioned, I've never had a doctor come to me and say, okay, let's run these tests to see what's causing. They're just like, okay, do you sweat at night when you go to sleep? I said no. And they asked me how long I've been sweating, and I told them since I was a kid. They're like, yes, hyperhidrosis. So that's a really important point. That's not something that crossed my mind before. And I think as patients of not patients, but as people with disorders that are quite rare, like hyperhidrosis, it's unfortunate that we have to be more aware. We can't diagnose ourselves, but we need to know that we're not, we don't resign ourselves to thinking, okay, I have this, I try out all these treatments. If they don't work, I probably need to live life this way. Like you mentioned, maybe there is something else that is causing it to be worse than it has to be. So that is a real possibility that people need to think about. That's a really good point. Yeah.
Let me ask you, Darini, how do you deal with situation anxiety?
How do I deal with it? Um, I mean, at that moment, I'm not really thinking so much about how I'm dealing with it. I just try to go on with it. And I think this question is like with regards to, how I sweat, right?
Mhm.
I always have a kerchief on my person, like a thick towel. So I bring that out. And even when I'm not sweating, right, since I've lived all my life with this, I tend to wear clothes and fabric that is very agreeable to my body,
Mm.
uh, you know, i- in a state where it's sweating full time. So I think preparation is key, because when the stressful situation happens to you, I'm not so good at controlling myself when that situation happens to me. I go all headless chicken. So I think when you are in a calm state of mind, prepare for it. And when you're expecting something, don't just make sure that you're not around your triggers, or and make sure that you can avoid those triggers as much as possible. Like, don't have like a ton of coffee before an important meeting. You're gonna end up sweating.
I'm a culprit.
Me too. And certain types of fabric really trigger sweating. Like, I can't tell you. Uh, it's like you touch it and you feel a certain type of a way, and you feel that rush coming on, and you're the next moment, you're sweating. So be very mindful of the clothing that you have on. Yeah, that's a very important factor. That helps a lot.